Hey everyone, it's Amin One and welcome back to Mystery Health. Today we're diving into a topic that's close to all of our hearts, literally. We're talking about those subtle signs and signals our bodies send us when something just isn't right. We brush off fatigue, ignore that nagging cough, or think a little mood swing is no big deal. But what if I told you that these seemingly small signs could be your body's way of crying out for help? In this video, we're going to uncover 10 shocking ways your body might be trying to tell you something's up, and trust me, you'll want to know what they are. So stick around, hit that subscribe button if you haven't already, and let's get into it. All right, let's kick things off with a symptom that many of us experience but often ignore: fatigue. Now, I'm not talking about feeling a little tired after a long day. I'm talking about that bone-deep exhaustion that just doesn't quit, no matter how much sleep you get. While normal tiredness usually goes away with rest, chronic fatigue is like that unwanted houseguest who just won't leave. It lingers, it drains you, and it can seriously impact your quality of life. When you're constantly exhausted, it's hard to focus, to be productive, or even to enjoy the things you love. Unexplained fatigue is often a sign that something else is going on in your body. It could be anything from iron deficiency anemia to a thyroid disorder, sleep apnea, or even a vitamin deficiency. So if you're feeling that persistent fatigue, don't brush it off. Talk to your doctor. It could be the key to unlocking your energy and getting back to living your life to the fullest. We often focus on how to make our skin look its best. But did you know that your skin is also a powerful indicator of your overall health? It's true. Think of it as a window into what's going on inside your body. Persistent changes in your skin can manifest in a variety of ways, from new moles or growths to changes in texture, color, or even temperature. For example, a mole that changes shape, color, or size could be a sign of skin cancer. Early detection is always key, so if you notice anything suspicious, don't hesitate to get it checked out by a dermatologist. Other skin conditions like eczema, psoriasis, and even acne can be triggered or exacerbated by underlying health issues. Thyroid disorders, autoimmune diseases, and even stress can all show up on your skin. If you notice any persistent or unusual changes, talk to your doctor or a dermatologist. They can help you determine the underlying cause and recommend the best course of treatment. Let's talk about digestion, shall we? It's not the most glamorous topic, I know, but it's incredibly important for our overall health and well-being. Your gut is a pretty good communicator too. It lets you know when it's happy, and it definitely lets you know when it's not. Persistent bloating, gas, constipation, diarrhea, these are all signs that something might be off in your gut. While they could be caused by something as simple as food sensitivities or a change in your diet, they could also be indicative of more serious conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, or even certain types of cancer. The gut is often referred to as our second brain because it's home to trillions of bacteria that play a crucial role in our overall health. When these bacteria are out of balance, it can lead to a whole host of problems, not just in our gut, but throughout our entire body. If you're experiencing persistent digestive issues, don't just suffer in silence. Talk to your doctor. They can help you figure out what's going on and recommend the best course of treatment to get your gut health back on track. Let's face it, headaches are the worst. They can range from a dull ache to a throbbing pain that makes it impossible to concentrate. While most headaches are nothing to worry about, frequent or severe headaches can be a sign of something more serious going on. Tension headaches, which are the most common type, are usually caused by stress, muscle tension, or even poor posture. Migraines, on the other hand, are a neurological condition that can cause intense, debilitating headaches, often accompanied by nausea, vomiting, and sensitivity to light and sound. Headaches can also be a symptom of other underlying health issues, such as high blood pressure, sinus infections, dental problems, and even brain tumors. Pay attention to the frequency, severity, and duration of your headaches, as well as any accompanying symptoms. If you're experiencing frequent or severe headaches, or if your headaches are different from what you normally experience, talk to your doctor. They can help you determine the underlying cause and recommend the best course of treatment to find relief. We all know that getting a good night's sleep is essential for our physical and mental health. But what happens when sleep becomes elusive? When you toss and turn all night, or wake up feeling exhausted, no matter how many hours you've logged in bed? Persistent sleep problems, whether it's difficulty falling asleep, staying asleep, or even excessive daytime sleepiness, can be a sign of underlying health issues. Sleep is when our bodies repair and rejuvenate themselves. It's when our brains consolidate memories and flush out toxins. When we don't get enough quality sleep, it affects everything from our mood and energy levels to our immune function and cognitive abilities. Conditions like insomnia, sleep apnea, restless leg syndrome, and even anxiety and depression can all disrupt our sleep patterns. If you're struggling to get a good night's rest, don't just accept it as part of life. Talk to your doctor. They can help you identify any underlying issues and recommend strategies to improve your sleep hygiene and get you back to waking up feeling refreshed and energized. We all have our ups and downs, right? But when those mood swings become more frequent, more intense, or start to interfere with your daily life, it's time to pay attention. Our emotions are not just in our heads, they're deeply connected to our physical health as well. Sudden or dramatic mood swings can be caused by a variety of factors, including hormonal imbalances, thyroid disorders, nutritional deficiencies, and even certain medications. For women, fluctuations in estrogen and progesterone levels throughout the menstrual cycle can lead to mood swings, especially in the days leading up to their period. Conditions like depression, anxiety, and bipolar disorder can also cause significant mood swings. Mental health is just as important as physical health. If you're experiencing mood swings that are causing you concern, don't brush them off or try to tough it out on your own. Talk to your doctor or a mental health professional. They can help you identify any underlying issues and recommend strategies to manage your mood and improve your overall well-being. Our weight naturally fluctuates a bit over time, but when you experience sudden or significant weight loss or gain without making any major changes to your diet or exercise routine, it's a definite red flag that something else might be going on. Unexplained weight loss can be a sign of a number of underlying health issues, including hypothyroidism, diabetes, celiac disease, and even certain types of cancer. On the other hand, unexplained weight gain can be a sign of hypothyroidism, Cushing's syndrome, or even heart failure. In some cases, medications like antidepressants or corticosteroids can also contribute to weight gain. Your weight is a vital sign, just like your blood pressure and heart rate. If you notice any significant or unexplained changes in your weight, don't ignore it. Talk to your doctor. They can help you determine the cause of your weight changes and recommend the appropriate course of action. Coughs are one of the most common reasons people seek medical attention. It's our body's natural way of clearing our airways of irritants and mucus. But while most coughs are temporary and resolve on their own, a persistent cough that lingers for weeks or even months can be a sign of something more serious. A dry, hacking cough might be a sign of allergies, asthma, or even GERD, while a wet, productive cough that brings up phlegm could indicate a respiratory infection, bronchitis, or even pneumonia. A cough that lasts for less than 3 weeks is usually considered acute and is most often caused by a viral infection like the common cold. But a cough that persists for more than 8 weeks is considered chronic and warrants further investigation. Chronic coughs can be caused by a variety of factors, including smoking, postnasal drip, asthma, COPD, and even lung cancer. If you're dealing with a cough that just won't quit, don't ignore it. Talk to your doctor. They can help you determine the underlying cause and recommend the best course of treatment to find relief. So there you have it. 10 shocking ways your body might be trying to tell you something's up. Remember, your body is pretty incredible. It's constantly working to keep you healthy and functioning at your best. The key is to be proactive. Pay attention to what your body is telling you. If something feels off, don't ignore it. Talk to your doctor. Early detection is key when it comes to most health issues. Thanks for watching, and I'll see you in the next video. Don't forget to like, comment and subscribe for more health tips.